Welcome to NC Spin Perspectives, thoughts from opinion leaders in North Carolina. Talking with Dr. Conrad Flick, who is a family physician in private practice in North Carolina. Conrad, the big issue that people have been talking about in North Carolina, in addition to the Affordable Care Act, has been Medicaid reform for the past 2 years. Why do we need to change Medicaid?
Well, I think all healthcare has issues as we change. It's taking care of patients the best way we can, but there's a financial obligation for communities, for our state. And I think the idea here is how do we provide the best care and get the best quality out of that limited number of finances that we have.
In these discussions, there's been implicit and implied accusations that the Department of Health and Human Services has mismanaged Medicare. As a family physician, what's your perspective on that?
Well, as I'm a family physician and a small business owner, so I have budgets just like everybody else has budgets. I think it's a large budget, and some of the overspends have been poor calculations on one side, but not a huge amount of the budget as it is. We need to do better. There's no doubt about that, but I think, to me, that's trying to figure out what's the best way to manage something they don't want to manage anymore.
Our governor and our lawmakers say we have got to have more predictable budgets. We've got to be able to prevent the annual cost overruns that Medicaid has experienced throughout the last several decades. Now, the Senate favors managed care organizations, while the House is favoring accountable care organizations. You recently wrote an op-ed article in the News and Observer in which you said you favored the ACOs over the MCOs. Tell us why.
Well, it's a long answer. I'll try to give you a couple short snippets. One is that if you're talking about how you manage health care, you need to have providers involved, people who actually have their feet on the ground and take care of patients every day. Managed care doesn't do that. Second, managed care is a business thing. They're looking at this from a financial reward for the people who are funding them and their stockholders. In North Carolina, the people who are running the Medicaid program, CCNC, I'm CCNC. I'm a provider. I am part of that organization. We do it because we have an obligation to our patients and our communities. Put us into the equation, help us to do it better and more cost efficiently.
There are some folks who are saying that we need to take Medicaid out from under the Department of Health and Human Services and form a separate state agency. What's your perspective on that?
Well, you know, we're trying to, a couple things. One, we're trying to make smaller government. That doesn't make much sense. But the bigger thing for me is that the Senate and even the governor said we want a system that's more person-oriented, more whole person-oriented. I've never met a group more person-oriented than CCNC is, and I've traveled the country and met other states who want to do what we do. But the second is, if you want whole person-oriented, why remove that department from behavioral health and all the other entities that are required in order to do it? Population management and the other things. You're splitting the patient by taking it out.
Former Secretary Lanier Kanzler said you can take it out of there if you want to, but it's going to have to be interrelating with all of the different parts of Medicaid. The other thing about this reorganization the Senate has favored is that it favors setting up an independent board, if you will. And as I read this, it doesn't look like they're talking about having doctors and hospitals involved in the running of this new Medicaid agency. How's that going to work?
That's a good question, isn't it? I think one of the things I liked about what the governor said when he said if we have problems with the educational system, we need educators and teachers to be at the table. We have a problem with Medicaid, and yet you want to set the table up where there are no providers who take care of it. Only business people who have the potential to financially gain by making it work for them.
Thank you for watching NC Spin Perspectives. We'll have more perspectives all during the week on ncspin.com.